Winter is coming and projections are really troublesome. Europe is slated to get 500,000 deaths by February 2022. And in the United States, already infections are picking up. So where the world is heading, there is someone who is keeping an eye on these things. And this is a professor of the University of Washington, Dr. Ali Mokdad. Welcome to Muslim Network TV. Assalamu alaikum.
Wa alaikum salam. Thank you for having me, brother.
Professor, this winter is coming and infection in the United States is picking up. So how this winter is projected to be like?
We're now projecting about 120,000 deaths between now and March 1st. And if 95% of Americans wear a mask, we are projecting 69,000 deaths left. So it's very important for all of us to remember that vaccines and masks will save our lives. Yes, we are projecting a surge right now. It will peak in mid-January in terms of infections. Mortality will peak the first week of February, and it will start coming down slowly after that.
So you're thinking of the holiday season, people will be careless and it will contribute, and winter is already there. So you expect it to peak in January. So what numbers we are looking at on the daily basis in January?
We're looking right now at our peak in terms of mortality, about 1,100 deaths a day when we peak. We will have less mortality this winter than what we have seen last summer and last winter, simply because more people are vaccinated. And the vaccines are highly effective against hospitalization and mortality, less effective without a booster or a third dose against infection. And that's why you see a rise in cases in many states that have high vaccination rate, because simply the people who received their vaccine in these states were early adopters of the vaccination campaign, and they received their vaccine by April. And now we have a waning immunity among those people unless they get a booster.
So booster, is there any campaign for people to really focus on booster? I mean, people who have taken vaccine, they're taking it easy. I mean, I was in a function just last weekend. There were 800 people and hardly anybody with mask.
No, that's not a good strategy. Let me explain it briefly. We have plenty of evidence right now that after 6 months of receiving your second dose, your immunity goes down against infection to about 20%, especially from Pfizer. It's a little bit higher in terms of if you are using Moderna. So it's very important for all of us to remember that fully vaccinated should be defined not 2 doses, but 3 doses right now. And that's what we do with all other vaccination. For many of us, we have 2 measles right now for our children, 2 measles doses. We have 3 DTP, 3 doses. We have 2 shingle doses. I mean, it's very important for us to remember this is a novel virus. The data right now and the science right now is telling us we need 3 shots to be fully protected, not 2 shots.
What are the chances that Moderna and Pfizer people will come back and say, well, every year you need to have 3 shots?
It's very possible. Look at the flu. We take a shot every year. Look at the Spanish flu pandemic right now, H1N1, it's still circulating, and we need to take a vaccine for flu every year. So it's very possibility for all of us to be prepared. And many countries, by the way, right now in Europe, for example, England is preparing itself to provide a yearly vaccination for COVID-19.
Professor Mokdad, one question troubles me is that in Europe, your projection, which World Health Organization in Europe has been talking about, is by February, they will have 500,000 deaths. And Europe is more vaccinated than the United States.
Exactly. So what's happening right now in Europe, it's very important to remind everybody. Yes, many countries in Europe have a higher vaccination rate than we do here have in the United States. So that's very true. But also they have the same problem that we are facing, waning immunity. Many of their people received their vaccine more than 6 months ago, and they are in a need of a booster in order to protect themselves from infection. So you'll see a rise in infections in Europe, but we're not seeing a proportional rise in mortality simply because the vaccines are highly effective for protection against hospitalization and mortality. Also, what's happening in Europe, in many countries right now, they're reversing it. Mobility increased and mask wearing went down. And that's why you see a combination of behavior, waning immunity, and seasonality of the virus. We're coming into winter. All of us are moving indoors. No more fresh air. The virus is more likely to be spreading indoors among people who are taking off their mask, sitting around a dinner table. That's why you see the surge in Europe. What's important to remember when you see a surge in Europe, what we have seen throughout this pandemic, they're ahead of us like 3 weeks. Whatever happens in Europe is going to happen here, given the conditions are the same. So look at the United States right now. We have high vaccination rate in many places, but we have a waning immunity problem. Mobility is very high. In many states right now, mobility is similar or even higher than what you used to have pre-COVID-19. And mask wearing in the United States is about 32%. Unfortunately, we're entering into winter with the holiday season and all the mobility and activities around the holidays. We're expecting a surge.
So do you expect another series of lockdown and the mandate that people cannot gather publicly and the congregations will be stopped and things like that?
I don't think so. Countries do not have any more an appetite for mandates. So what they are trying to do right now is having a mandate to basically encourage people to get the vaccine. You can't get into a restaurant without showing a proof of vaccination. And that's what many European countries are doing. And when all of these are failing, some European countries right now, they have a curfew at night. Netherlands is already starting a curfew at night. So some countries are doing this on a geographic location, but not at the national level, because there is a balance between livelihood and between lives. And in many countries, as you know, they are suffering economically and they can't afford to shut down.
Professor Mokdad, this pandemic death have been around all over, but the way it happened in India was extremely unique. And it seems like a tsunami of deaths, and people were unable to even bury their people or cremate their people as Hindus do. And they were throwing bodies left and right. Now, BBC report says that they have identified a gene which makes South Asians more susceptible to this virus. What are your thoughts about that?
I disagree. I don't think it's genetic. If you look at what happened in India because of the Delta variant, India, take for example, Delhi. And Delhi, before Delta hit, they had about 67% of people infected already. And they felt they're safe. They've been infected, so they can keep going, doing our businesses as usual. And what happened, Delta arrived, and Delta was more infectious, and Delta is an escape variant. Even if you've been exposed and got COVID-19 before, Alpha variant or other variants, you were infected. So it really spread so fast in India. But when you look at India, for example, compare it to Bangladesh and Pakistan, we didn't see that high rates of mortality in Pakistan, for example. They're similar countries, they're similar genetically. Same people in a way. I mean, they were one country. So I don't think it's genetic. It's simply Delta variant that has happened and hit them hard. And unfortunately, because it happened first in India, many other countries learned their lessons and they put their guards up and they were saved. And India, unfortunately, suffered a little bit more than the neighbors.
Professor Mokdad, while working at this number, I mean, you deal about the numbers of infections and death and pandemic, 15 million people dead around the world. Do you sometimes get depressed about working on these numbers?
Yes, definitely. It has been very difficult. I lost also 2 cousins, brothers, 3 days apart from COVID-19 in Lebanon. So my family, my nephew is not vaccinated because my family is in Lebanon. And I have a family in Yemen. They don't have vaccines and they're not vaccinated. So it has been very difficult for us counting, number of dead and number of infected. I know from personal experience, this is a loved person, a cousin, a brother, a father. So it has been very difficult for all of us. What has made it difficult, especially after last December, quite honestly, is the fact that we have a vaccine. It has been very hard on all of us and quite honestly depressing sometimes. because we have a mean to prevent all these mortalities. Over 150,000 deaths in the United States were after vaccines. I mean, we could have prevented all of these deaths. It has been very difficult for us. We get our message out every day and say, please get your vaccine, get your booster, wear a mask. Nobody is listening. And it has been very difficult at a time where somebody like me, I live in a country where we have plenty of vaccine. We're lucky to have plenty of vaccines and we should use them. And I have family who's waiting in line to get a vaccine. It's very difficult on a personal level, on a human being level, as a Muslim, seeing all these people dying that I know could be prevented in the United States and elsewhere. Preventing a death is very important in our religion and our culture and our beliefs. It has been very difficult, brother. It has been very difficult.
Thank you so much, Professor Mokdad, for your work. I know it's not easy, but it's rewarding. So many people get alerted and pay attention to the need to fix their act. I hope more and more people will listen that you are lucky to have a vaccine, and your relatives and my relatives and millions of people around the world simply don't have access to it. It's a great state indeed. Thank you so much, Professor.
Thank you, and assalamu alaikum.
Alaikum salam wa rahmatullahi wa barakatuh. Thank you for your time.